Hello friends, let us now learn some important points about ultrasound artifacts. So in the ultrasound artifacts, there are few lists. One, acoustic enhancement artifacts, acoustic shadowing artifacts, lateral cystic shadow artifacts, wide beam artifacts, side lobe artifacts, reverberation artifacts, and mirror image artifacts. First, acoustic enhancement artifacts. So these acoustic enhancement will increase through transmission. This increased through transmission will occur whenever there is some fluid filled structures are seen. These fluid filled structures will allow the ultrasound rays to pass directly without any attenuation to the opposite structure. So as a result, this will result in increase in intensity of X-rays just or intensity of ultrasound. There is increase in intensity of ultrasound echoes from the tissues just behind them. So this is called as acoustic enhancement. The next is acoustic shadowing. In acoustic shadowing, whenever there is strongly attenuated substance or strongly reflecting surfaces like bone, gallstones, or if there is any gallstone sludge or gallbladder stones, bowel, gas, or lung, all these will not allow the ultrasound beam to pass through it. They are strongly attenuated by these gallstones or highly attenuating substances. And as a result, as ultrasound a beam cannot pass through them, there is decreased intensity of echoes is seen behind them. So this will result in acoustic shadowing. So the prevention is using different angles of scan can be used to see this structure. Then the next important thing is reverberation artifacts. In reverberation artifacts, whenever we see parallel, highly reflective interfaces are seen. These highly reflective interfaces, see, this is a strong reflector. When there is a strong reflector, then the ultrasound beam which has come, this ultrasound beam will start reflecting back to the transducer. The one which has the ultrasound beam which is transmitting it won't transmit but it reflects back. So because it reflects near the surface, it produces series of delayed echoes. These are the series of delayed echoes which are called as reverberation artifacts. These reverberation artifacts are of two types. One, we have comet tail artifacts can be present. Second, we can have ring down artifacts present, can also be present. Ring down artifacts and comet tail artifacts are also two types of reverberation artifacts. This is actually the reverberation artifact seen in lung. Comet tail artifacts is mainly seen whenever there is a small gas bubble. This gas bubble will not allow the gas bubble is actually also has a strong reflecting surface, so it reflects the ultrasound beam. So as a result, this shows tracks of lines through the scan. So this is called as, if it is bubbles, because of bubbles, so it is called as ring down artifacts. Whereas in comet tail artifacts, some metallic thing or either calcified substances will not allow the X-ray beam to pass through it and it will reflect it. So this will produce reverberation artifacts, causing reverberation artifacts, which is called as comet tail artifacts. Then we have mirror image artifacts. In mirror image artifacts, whenever a strong reflecting surface is present, this is a strong reflecting surface, and this is the liver. This diaphragm acts as a strong reflecting surface, creating the effect of mirror. So, as a result, this liver is itself, seen here beyond the reflector. This mirror image of liver is seen beyond the reflector, and this is called as mirror image artifact. So, diaphragm and the liver parenchyma is the main example of this mirror image artifact. Then we have lateral cystic artifacts or edge shadowing, lateral cystic or edge shadowing. In this, what actually happens is because of the attenuation and rarefaction at the edge of the curved structures, at the edge of the curved structures, you can see these hypoechoic zones which are called as lateral cystic shadowing. Then whenever there is gallstones, gas in the duodenum, This is the duodenum. So gas in the duodenum may simulate the stones. So this is called as beam width artifacts. Then the next thing we have is side lobe artifacts. In side lobe artifacts, whenever near the transducer, whenever there are small vibrations are seen in the lateral edge of piezoelectric crystal, these small vibrations will produce these side lobe like structures, and these are seen mainly in the urinary bladder, where because of the vibrations of the urine here which is seen, this will result in this side lobe artifact. So these are the different types of artifacts which are seen in ultrasonography. Thank you.